CBT for borderline personality disorder. A step-by-step, comprehensive guide to emotional regulation, mindfulness, and interpersonal skills for lasting recovery. Written by Katherine Johnson. And narrated by Archie G. The names and scenarios depicted in this book are purely for illustrative purposes only. Any resemblance to actual persons, living or dead, or actual events is purely coincidental. The scenarios are designed to demonstrate the application of the book's principles in various life situations. Overview of borderline personality disorder, BPD. Borderline personality disorder, BPD, is a complex mental health condition characterized by a pervasive pattern of instability in interpersonal relationships, self-image, and emotions. It is estimated to affect approximately 1.6% to 5.9% of the general population. BPD typically begins in adolescence or early adulthood and is more commonly diagnosed in women than men. The term borderline was initially used to describe individuals who seem to be on the border between neurosis and psychosis. However, BPD is now recognized as a distinct disorder that affects an individual's ability to regulate emotions, maintain stable relationships, and manage their sense of self. The symptoms of BPD can be grouped into four main areas: emotional dysregulation, interpersonal difficulties, impulsive behaviors, and identity disturbances. Emotional dysregulation. Individuals with BPD experience intense emotions that are often disproportionate to the triggering event. These emotions can be challenging to manage and may change rapidly. For example, a person with BPD may feel extreme anger after a minor disagreement or overwhelming sadness after a slight criticism. They may also experience chronic feelings of emptiness or emotional numbness. Example: a person with BPD might be extremely upset and feel abandoned when their partner is late for a date, even if it's only by a few minutes. The emotional reaction may be so intense that they engage in self-harm or become verbally aggressive towards their partner. Interpersonal difficulties. BPD is marked by unstable and intense relationships, characterized by a pattern of idealization and devaluation. People with BPD may view others as either all good or all bad, which can lead to intense short-lived relationships with frequent conflicts. They often fear abandonment and may make frantic efforts to avoid real or imagined separation. Example: an individual with BPD might become overly attached to a new friend or romantic partner, idealizing them and placing them on a pedestal. However, when the friend or partner inevitably disappoints them in some way, the person with BPD may suddenly devalue the relationship, seeing the other person as entirely flawed and unworthy of their affection. Impulsive behaviors. BPD often involves impulsivity, which can manifest in various ways, including reckless spending, substance abuse, risky sexual behaviors, binge eating, or self-harming. These behaviors are typically an attempt to cope with intense emotions or to feel a sense of control. Example: a person with BPD may engage in dangerous driving or excessive alcohol consumption after a stressful day at work. These impulsive behaviors provide temporary relief from their emotional pain, but can have long-term negative consequences. Identity disturbances. The role of cognitive behavioral therapy, CBT, in treating BPD. Cognitive behavioral therapy, CBT, is an evidence-based psychological treatment that has been proven effective for a range of mental health disorders, including borderline personality disorder, BPD. CBT is a structured, time-limited, and goal-oriented approach that focuses on the interplay between thoughts, emotions, and behaviors. It aims to help individuals identify and modify maladaptive thinking patterns and behaviors, thereby reducing emotional distress and improving overall functioning. In the context of BPD, CBT plays a crucial role in addressing the core symptoms, such as emotional dysregulation, interpersonal difficulties, impulsivity, and identity disturbances. The following sections will provide a detailed explanation of how CBT is applied in the treatment of BPD, along with relevant examples. Emotional regulation. One of the primary goals of CBT for BPD is to help individuals develop better emotional regulation skills. Emotional dysregulation is a hallmark of BPD, and it can lead to intense and rapidly fluctuating emotions that are difficult to manage. CBT techniques used for emotional regulation include A. Identifying and labeling emotions. Individuals with BPD may struggle to recognize and accurately label their emotions. Through CBT, they learn to observe and describe their emotional experiences without judgment, which helps them gain better control over their emotions. Example: a therapist may ask a person with BPD to maintain an emotion journal, where they record their emotional experiences throughout the day, along with the triggering events and their intensity. B. Cognitive restructuring. This CBT technique involves identifying and challenging irrational or distorted thoughts that contribute to emotional distress. By modifying these thought patterns, individuals with BPD can reduce the intensity of their emotional reactions. Example: a person with BPD may think, "If my partner doesn't call me back immediately, they must not care about me." The therapist helps them recognize and challenge this thought by examining the evidence and exploring alternative explanations. C. Mindfulness and relaxation techniques. CBT often incorporates mindfulness exercises and relaxation techniques, such as deep breathing or progressive muscle relaxation, to help individuals with BPD manage their emotions more effectively. Example: a therapist might teach a person with BPD to practice mindfulness meditation, focusing on their breath and observing their thoughts and emotions without judgment. Interpersonal effectiveness. CBT for BPD aims to improve individuals' interpersonal skills, helping them navigate relationships more effectively and reduce conflicts. Key CBT techniques for interpersonal effectiveness include A. Communication skills training. Individuals with BPD often struggle with effective communication, which can lead to misunderstandings and conflicts. CBT helps them develop assertive communication skills, enabling them to express their needs and feelings appropriately. Example: a therapist may use role-play exercises to help a person with BPD practice assertive communication, such as expressing their feelings about a disagreement with a friend. B. Boundary setting and negotiation. CBT teaches individuals with BPD to set healthy boundaries and negotiate their needs in relationships, promoting a sense of autonomy and reducing the fear of abandonment. Example: a therapist may help a person with BPD identify areas in their life where they need to set boundaries, such as limiting the amount of time they spend with a demanding friend or family member. C. Conflict resolution. CBT equips individuals with BPD with the skills needed to resolve conflicts effectively, including active listening, empathy, and problem solving. Example: a therapist may use role-play exercises to help a person with BPD practice resolving a conflict with a coworker or romantic partner. Impulse control. Impulsivity is a common feature of BPD, and it can lead to self-destructive behaviors. CBT for BPD focuses on developing impulse control skills to help individuals manage their urges and make healthier choices. Some CBT techniques for impulse control include A. Mindfulness and self-awareness. By cultivating mindfulness and self-awareness, individuals with BPD can become more attuned to their impulses and better equipped to manage them. They learn to pause and evaluate their urges, rather than acting on them immediately. Example: a therapist may teach a person with BPD to practice mindfulness techniques that allow them to recognize the early signs of impulsive urges, such as increased heart rate or restlessness, and to take a step back before acting on them. B. Behavioral activation and modification. CBT helps individuals with BPD identify the triggers for their impulsive behaviors and develop alternative, healthier ways of coping with these triggers. Example: A person with BPD who engages in impulsive spending may work with a therapist to create a budget and develop alternative coping strategies, such as exercise or journaling, to manage stress without resorting to overspending. C. Coping strategies and delay of gratification. CBT teaches individuals with BPD to develop coping strategies for managing their impulses and to practice delaying gratification to reduce impulsive behaviors. Example: a therapist may help a person with BPD practice waiting for a specific period before acting on an impulse, gradually increasing the delay time to strengthen their impulse control. Identity disturbances. Individuals with BPD often struggle with a stable sense of self, leading to shifting goals, values, and self-image. CBT aims to help them develop a more consistent and coherent sense of identity. Some techniques include: A. Exploring values and goals. CBT encourages individuals with BPD to explore and clarify their values and long-term goals, fostering a more stable sense of self and direction in life. Example: a therapist may ask a person with BPD to create a values and goals list, ranking their priorities and discussing how these values align with their current choices and behaviors. B. Challenging negative self-beliefs. CBT helps individuals with BPD identify and challenge negative beliefs about themselves, promoting a more balanced and positive self-image. Example: a person with BPD may believe they are unworthy of love or success. A therapist will help them examine the evidence for these beliefs and develop alternative, more adaptive thoughts about themselves. C. Building self-esteem and self-compassion. CBT teaches individuals with BPD to cultivate self-esteem and self-compassion, which can help them develop a more stable and positive sense of self. Example: a therapist may guide a person with BPD through self-compassion exercises, such as writing a letter to themselves from the perspective of a supportive friend or practicing loving-kindness meditation. In summary, CBT plays a vital role in treating BPD by addressing its core symptoms and helping individuals develop the skills needed to manage their emotions, navigate relationships, control impulses, and maintain a stable sense of self. By utilizing various CBT techniques and exercises, individuals with BPD can experience significant improvements in their mental health and overall functioning. It is important to note that the success of CBT in treating BPD often relies on the individual's commitment and active participation in therapy, as well as the skill and experience of the therapist. With consistent effort and dedication, CBT can offer individuals with BPD the tools they need to lead healthier, more fulfilling lives.
Thank you for tuning into our audiobook. If you're enjoying the story and would like to experience the full narration, we invite you to read the video description below. There you'll find all the details necessary to immerse yourself fully in this audio journey. And if you appreciate our content, don't forget to subscribe to our channel for more amazing audiobooks. Happy listening!